Hey, deserving listeners, 90 Day Fiancé, The Last Resort. Let's watch.
All these things on this paper is something I have to work on a lot. I have to learn to stick up for myself.
What I realized is I need to start using my voice more. I do feel like I need to bring that to the relationship. I just feel like we need to work on how I can do that.
Yeah, absolutely. I don't think anyone would disagree with that revelation. I imagine that's not a revelation for her. I imagine she's known that even before she ever met Ed, that she struggles with that. But without couple therapy, effective couple therapy, that isn't likely to go well. In fact, not because of her problems, but because of his. A lot of people will go to individual therapy as a way of trying to work on their relationships, which isn't always wise. As a couple therapist, a marriage and family therapist myself, it will annoy us sometimes when people do that. It's like going to a dentist to get a haircut or something, or going to a dentist to, fix your foot. There's specialists out there, and also appropriate or venues that are more likely, modalities that are more likely to address the problem. When you're trying to work on a relationship, not always, it depends on the situation, it is optimal if the couple is in the room with the clinician, right? For a lot of reasons, two reasons that come to mind is that you're going to hear different stories from both people. I will often say this, that when I treat couples, I will always hear two completely different stories when they recall a conflict that they had, even if it was earlier that day. Sometimes they're literally conflicting as they're coming into my office, and they will tell me a different story. And depending on the level of differentiation, there will be a greater degree of disagreement regarding what exactly happened. Now, very rarely, this will be a product of someone who knows that they're lying. They know that they are leaving out certain aspects of the fight the night before because they're ashamed, or they're trying to manipulate, or they're psychopathic or something. But the vast majority of the time, I hear different stories because they literally believe different stories. So that's a very important reason why both people need to be in the room, because as you know, I also treat a lot of individuals, and when I hear them talk about their fight or their spouse, because I have the experience working with couples, I'm always wondering what the other side of the story is. I don't tell the client this. I don't say, well, I'm sure you're distorted or something. I'm just always trying to figure out what's going to be helpful. And it often is not very helpful for therapists to just straight up agree with every story and narrative and schema that the client is presenting to us. It doesn't serve anybody for me to just take everything that a client is telling me as the truth. So now it depends, of course. There's a lot of different factors. If there's abuse happening, it's a completely different story. But so that's one thing that I will see in the world, and I wonder what's going to happen here. The other thing is that a lot of therapy will involve finding your voice, which is great. Finding your assertiveness, discovering things that you've been suppressing, sweeping under the rug, being validated for things that you have been invalidated for by many people, including your spouse or other people. And you will feel emboldened, or you will feel, you'll have motivation to go home and to speak your voice and assert yourself, which, of course, so that's what's happening with her. And of course, that is a wonderful thing, and one of the main benefits of going to therapy. But without a plan and without couple therapy, then it isn't likely to go very well, especially with a couple like this. So, in that she might assert herself in a way that is not careful, but I don't know. I think she tends to assert herself pretty well. But the other thing, if her goal is leaving therapy, she's like, oh, I've discovered my voice. If her goal is to, keep enacting her assertiveness and her voice at the sacrifice of everything else, then there's not a big reason for couple therapy, because she can just assert herself in a fair way. And if that ruins the relationship, then that's just what happens. Or if her goal is to assert herself and test the waters as to whether or not the relationship or Ed could even tolerate such a thing, then she doesn't, they don't need couple therapy. But if the goal is, I want to assert myself because I want to improve our relationship, I don't want to tank the relationship, I want it to go well, and a part of it going well means I have to learn how to assert myself, and he has to learn how to tolerate that. Well, then without a help, without a couple therapists there, what will almost always happen, especially in a couple like this, is that she will find her voice, she will feel emboldened, whether it's in therapy or when she talks with a friend. She goes home, she asserts herself, and everything blows up. And then what often will happen is, and I've had this happen many times with clients, they will come to me in individual therapy, and they will say, well, thanks, doc, because I asserted myself like we talked about last week, and everything blew up, and now things are even worse. So I need to figure out a different strategy. And then the Liz's of the world will shut down. And I think that's happened a lot. I don't think she actually has a really big problem asserting her voice. I think Ed has a problem hearing her voice. She has said many things on camera, God knows what she said off camera, that have been confrontational and have been speaking her voice and asserting herself. And if anything, she's, a little accommodating in that way. But, when push comes to shove, she'll speak her mind. And so that's not the problem. The problem is something's going on in him. And until that gets changed, then it's not likely to change. So I wonder how this is going to go.
I still have a load of things to work on. I know that. But
okay, so normally when I hear something like that, I'm like, yay, but where's the evidence? Where's the beef? Show me the money. And other contemporary statements that young kids are currently saying, right? So normally I would be like, yeah, it's great. But every time he says something like that, it will, well, actually, there's a whole pattern. So if, we've seen this many times. I would be surprised if, it's hard to know what's going on in his head, really. We have some guesses to make some speculations, but, meaning that I don't know if he has any capacity for self-reflection and for humility. I mean, I think he does kind of, but I've worked with clients who have one of the thickest barriers between them and any sort of insight or humility or admitting that they did something wrong. I mean, it's a problem, and I butt up against those barriers all the time, especially because therapy is, to a large extent, an activity of discovering you're 97% a good person and you're 3% an asshole, and being able to tolerate and being able to handle that acknowledgement that, boy, I made a mistake there, or I have some unfortunate personality traits. Because if you can't look at that, then you're just going to blame everyone else for your problems, right? And we all deserve to be able to look at and not be ashamed of our 3% dickishness, because we all have it. It's a law of the universe. And so I've run into it a lot, and I don't hear him having that. And most people don't, honestly, but there's some people that are particularly bad about it. Anyway, what often happens is that there will be this mode that the two of them will be in, but it's more concerning with him. I think he's in a constant state of gaming the situation and avoiding and blaming. He thinks it's actually helpful, I think, to do that to retain attachment, because he's thinking about himself. But what he doesn't realize is it actually pushes people away. And I think he's doing it as in an effort to actually keep Liz around. He needs her, but he doesn't know how to work with any sort of idea that he might have done something wrong. And, and we all do this, but some people are more pathological about it. When our partner comes to us and says, that personality trait of yours or that thing you did the other day, that hurt my feelings, or that bothers me, or that's not good for the relationship. Almost everyone, if not everyone, has a knee-jerk reaction to say, no, it didn't. No, that didn't happen. What are you talking about? You're misinterpreting it. You're looking at it wrong. And it's this weird compulsion to just tell someone that they didn't see what they saw or that they are just distorted all the time and they just need to let it go. By the time your partner is telling you something, in all likelihood, it's like the 15th time that it happened, and they did let it go 14 times, and now they're finally telling you. Anyway, so for him, so I think that's his constant vigilance because of the traumas he's been through. And when in this particular kind of mode, she just came out of therapy, and she is saying, I discovered that I have to assert myself. So there are the cameras, and he intuits that the therapist and her have, they've established that. So for Ed, he can't just discount that because the therapist and the authority, and he probably also knows that he has to answer to the therapist at some point if he were to just shut this whole thing down. So he can't do that. So what he does, and he's done this many times on the show, when the context denies him that ability to just shut it down and move on, is that he will start by saying something that he just said. He will start by saying something like, I have problems. And what that does, what he's learned, I hope subconsciously, I hope it's not a conscious manipulation, but you never know. I imagine it's more subconscious, that he's learned that if he says that, and he might even slightly mean it, and if he says that, then the tension goes down, people open up, there's more trust and more hope because I'm guessing everything that he's done, well, of course we know because he did it with Rose, but with Liz, we have way more data. But I'm guessing his style of reacting to this goes back a long, long time. But I don't know that. Anyway, so he says that, in the previous season when they were at that bar after the tell-all or whatever, people are drinking, and I think he was backed into a corner and at a certain point and realized he couldn't just blow it off and blow her off. So he apologized, and then that disarmed her, and then very quickly he, within a couple minutes, he was the one berating her. He just transitions into that. If you're truly sorry, and if he truly is in that statement of I have problems that I need to work on, then the future things that you say directly after that will reflect that notion. But he doesn't do that. What he says is he throws that out there, and then he works his way around back to everything is your fault. But I don't know. Let's watch. Today's video is sponsored by Ada. So I got COVID recently. It was probably the sickest I've ever been in my entire life. It was the worst. Well, did you know there are treatments you can take for COVID-19? And that means that there's something you can do if you get COVID, things you can do to avoid getting really sick. And that's where Ada comes in. You take their free questionnaire online. I've taken it. It's confidential. And you find out if you or a loved one may be eligible for treatment. If eligible, you can talk to a clinician via telehealth within 2 hours. And if prescribed, you can pick up your treatment from a local pharmacy. So click the link below to find out if you are eligible and learn more about treatment options.
There's no question that I want to be with you, that you're the one for me. There's no more of that. So I'm going to start there.
And that statement makes no sense, and Liz would be dumb, and I don't think she's dumb, to regard that. He's probably said that hundreds of times, both what he's saying now and I'm done with you, get away from me. So unless he has some elaborate analysis that's brand new, then that is a completely meaningless statement. And, who knows? This could all be shenanigans or edited or whatever. I'm telling this for your sake, not only lay people, but clinicians, because, almost everything that we say, particularly in conflicts like this, I don't know if I've ever said this out loud, but almost everything we say, it has multiple layers and meanings and caveats. There's nothing. So when we're hearing something from other people, and frankly, when we're observing ourselves saying certain things, it's helpful, especially when there's such a critical moment of communication like right now. It can be helpful to look at the pattern within context, look at what are they trying to say, what do they want me to know, where is this coming from? And so you just have to be analytical in that way. And for him, he's saying, look, I want to be with you. Those days are over. And, maybe they are. I can't know. I'm not in his heart. But that theme of you're the one for me and there's no question, and then a day later, I'm done with you, get away with you, here, give me the ring back or get away from me. They've broken up, I think, countless times. No joke, right? I think I wouldn't be surprised if meaning that they've absolutely broken up, like we're broken up. And if you also include all the pseudo breakups or half breakups where it's basically implied that they've broken up, I wouldn't be surprised if it's happened 200, 300, 400 times. So they've been together for years, and I think they fight frequently, So that's another meaningless statement based on context. Anyone else saying that, or if I didn't know Ed, I'd be like, well, that's encouraging. But so my point is that if I were in Liz's shoes and I heard that, the first thing I would ask is, okay, so, no offense, but you've said that before. So what has changed that you would feel so confident in saying that to me now? Or has anything changed? And if he didn't have anything convincing, I would say, oh, well, then I'm not going to trust that statement that he thinks that there's something wrong with him that he needs to work on, like any other human, and that he's done breaking up with me. Whereas if he said something like, well, I know that I've said that statement before, and in the past, I didn't really mean it because I was just trying to say anything that would get you to love me and stay with me and end the fight. That's kind of my strategy. But I've learned that that's not helpful to you or to me or our relationship. So I have spent a lot of time in therapy, not with probably this therapist, but I don't know, who knows. But I spent a lot of time in therapy, and I now have a path forward to dealing with my reactivity. When I am jealous or triggered or I feel abandonment coming on, I actually now have a different way. I can see it coming. And even though I might still be new to this discovery, I know that the impulse to break up with you is just a way for me to protect myself, but ultimately it's not really what I want. And so I'm fairly confident that I'll be able to nip that in the bud moving forward. If he said something like that, then I still would imagine that he would still do it. But at least there's some acknowledgement of it, and maybe he would recover faster. In the absence of any explanation, if I were Liz, I'd be like, that's a completely meaningless statement. You've said that several, maybe hundreds of times, dozens of times, and then you broke up with me the next day. So I'm just not going to trust that.
I still have a load of things to work on. I know that. But there's no question that I want to be with you, that you're the one for me. There's no more of that. So I'm going to start there. I'm still going to be funny, though, so. And
then that face that he makes. I don't know, but we've seen that face before, that Bill Clinton kind of thing, biting his lip. And who knows, maybe it does point to a sincerity in him, but that face has, and these statements have often preceded some abusive behavior, some verbally, what I would call verbally or emotionally abusive behavior, manipulative behavior, blaming behavior, shaming behavior. a rigid adherence to he's always right and she's always wrong. That's my suspicion, and if I were Liz, I would have that suspicion. I would see that face, I would hear those statements, and I'd be like, in fact, it might even be a preamble to get people to relax so that he can actually get in. We've seen this before where that's not what's happening right now, but where Liz is actually seemingly having 9 toes out of the door, and then he will say things like this and have that face, and then she'll put all of her toes back in the door, and then he will reinitiate his blasting of her and putting her down. So he might even perceive that overall, based on the arc of their current cycle that they're on, that he needs to have that. I want to be clear, though, that if this is a manipulation, there's a pretty good chance that it's not a conscious thing, that he's not saying, this is what I need to do to trick her. Most people, especially on the internet, will characterize that sort of thing. They'll always call it narcissism. It's not a hallmark of narcissism. It's a hallmark of being a human, honestly, to some extent. But I'm not saying it's conscious. It would be, if he took a lie detector test, I would suspect that he would pass. He'd be like, no, I believe. I'm never going to say that again. I believe that I do have problems. Absolutely, I believe that. But it's shallow, even to himself. It's almost like there's a part of him that says it to her, but also to him. But that part of him avoids going deeper because that part of him is afraid of what's deeper. So that's my thinking.
Relationship, it will help us out better in the long run.
I agree. I think we should really ask Petey if there is such a thing as future life hypnosis. So we are able to look forward in time to see how Arkansas will work out, or at least get the winning lottery numbers while we're at it.
Now, there's nothing wrong with using humor, even in moments like this. I have clients who will use humor in what I would characterize as healthy ways. And in fact, it can actually be unhealthy not to joke around sometimes. It can really help in couple relationships, but also in couple therapy sometimes, just to have a little joke. But I think there's a pattern we're seeing with him anyway, that he is resorting to more of it as a defense, because I think this is actually very, very challenging for him, because the expectation is that there's going to be all this therapy, and that for him, I think, scares him because he won't be able to wiggle his way out in the way that he normally does, and from vulnerability and what he might be perceiving as harm. The other kind of odd thing is that the narrative seems to be, at least from Ed, that he's a jokester, that he's funny, and that's never been I'm not putting him down. I'm just saying that's not my association with him. Maybe he is off camera or something, but so that's just another part to it, that I think there seems to be some kind of new approach, and he's inventing this idea that he's this comedian as a smokescreen, I think. And I don't think it's, well, I would imagine it's probably there's two purposes to the smokescreen of this humor thing. Is one, avoiding vulnerability. The condition that I would hypothesize that I would, the condition that I would pursue, the hypothesis that I would pursue if I treated someone like Ed, and I would have to do a lot of trial and error and assessment and getting to know the client before I could solidly say this. But the hypothesis is that due to early childhood relational traumas and beyond, he had to convince himself and everyone around him that he's self-sufficient, that he's fine, he doesn't need anyone, he's logical, he doesn't have emotions, other people do, and they're the problem, and he is totally fine on his own. In fact, he's super, and he's smart, and he's mature, and he's funny, and he's interesting, and he needs to be constantly signaling that to other people and himself. But deep down, he's very, 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 very ashamed of himself, hates himself, and it's a it's a very primitive feeling. It's, like for me, there are times when I will feel ashamed of myself and I won't like myself, but it's differentiated and, mature in the sense that I don't fall into the deep end of that. I don't fall off a cliff into an abyss of shame. For some of you, you might actually have that because of the experiences you've had, and you've yet to have enough corrective experiences and discovery of your foundation. For me, when I am ashamed of myself or I do hate myself, so to speak, I will have a pretty quick sense of my worth based on how I've been treated my whole life. So for him, I suspect that's not there. And so when I don't know that, but that's my hypothesis, and that any question, even in his own mind, that he might be to blame, he thinks he's risking falling off into the abyss of shame and no one will ever love me and I'm a terrible human being. We've seen that presentation from him. I always remember that very first season with him and Rose, when Rose actually left him. And he had been mistreating her and just acting like everything is fine. And then all of a sudden, boom, she's gone, and he was cornered. He didn't have his normal defenses to call upon to trick himself into believing that everything's fine. And he descended. But the descent is childish in that there's no self-discovery. It's just like, I'm worthless and no one's ever going to love me, and someone please save me. And that's basically it. When you have a kid that descends into shame, it makes sense that they don't have those resources and that resilience. They don't have that inner ability to sift through it and make plans and ask for help or whatever. For kids, they need us as caregivers, as parents, as teachers, as siblings, as therapists to guide them and be with them, and good relationships will involve that. The kids will involve us in that whole thing. They don't, hopefully they don't exist in those emotional moments by themselves in isolation. They're signaling or just literally asking you like, and they need us. So for him, even though he's walking around like an adult, a lot of traumatized people on the inside, they have that childish. I'm not saying that as an insult. I'm saying that as a product of trauma. And so for him, the prospect of having to talk about his feelings and have a therapist or a set of therapists that will actually support Liz, which he intuits would happen because that's often what happens in his life, I imagine, but also just culturally, most people in his position would assume that a therapist would feel bad for Liz and support her. So it threatens his whole scheme, his whole defensive strategy, and that's very scary. It's terrifying. So he has to figure out some way of evading that. And I think he's resorting to humor a lot more, and a persona of humor as some way of putting up a smokescreen. Anyway, but also putting up a smokescreen to himself, and also putting up a smokescreen for Liz. Okay, well, let's adjourn there, and everyone, please take care of yourself because you deserve it. You really, really do.